Good morning. Good morning. Good morning. Oh, look, we here 9 o'clock on the nose. Look at God.
Good morning.
Good morning. Good morning. Welcome, everybody. If you cannot hear in the world, I am so sorry. I'm trying. We did. I tested. You know how that goes. But anyway, welcome to our Saturday morning tea, where we discuss health information, news, education, and certification tips. And today, Q&As. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And before I introduce my co-host, today's episode is sponsored by PRN's free email course on the 5 steps to become a certified marketable medical coder. Now, you people over in Clubhouse may not be able to hear this for some reason. We having technical challenges, but I'm going to play this little ad real quick and then we'll come right back. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. Okay. So the wonderful thing about you people in Clubhouse is that you have a little link that you could just click right on if you are interested in the becoming the 5 steps to become a certified marketable medical coder. For YouTube and Facebook, you guys, you can check out the video description and you'll see the link in there. So, joining me this morning is my co-host, Mr. Jesse, the coding nurse. Sir, you know what to do. Introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia, Pennsylvania. I have been LPN for almost 29 years, and about 8 years ago, I transitioned into medical coding. And in July 2020, I started a company called the Coding Nurse, where I help nurses and other healthcare professionals transition into the world of HR.
Okay. Mr. Jesse, you're choppy. I don't know. I can hear
It
you, but you go in and out.
exactly. You know what? I want. Can we bring somebody else up to the stage to see if
Oh,
this
yeah, I'm sorry. My bad.
to see if it's just me?
Moderator. Yes. Come on up to the stage. Here we have the LPN. Oh, wait, she's coming in. I'd like to speak.
Hey, if she mute her because she has devices on, you can
Yeah,
hear her.
copy too.
So I need to mute me.
Yes, because you got on at the same time as well.
Okay. So can you hear me now?
And now it'll be much clearer when someone else speaks.
Oh yeah, it is much clearer.
It is. It's me. But can you hear me? But you can't hear me.
No,
Okay.
no, so you unmute when you want to speak, but then mute when you're not speaking. I guess that's how you have to do it. Because now that you're muted, Claire, the LPN boss was very clear.
And you are
But
too.
I don't. But now I don't hear myself. What I'm not. I'm not supposed to,
Okay.
which is good.
Okay. But I'm hoping that the people can you hear me? No. Okay, but I'm not certain whether or not the YouTube and Facebook people hear me when I'm muted. But we'll see. We'll work it out. Okay. So, do you want to give your introduction again? Because you were quite choppy, and I'll mute me so you could talk.
Okay. My name is Jesse Gallup. I live in Philadelphia, Pennsylvania. I've been an LPN for almost 29 years. And about 8 years ago, I transitioned into medical coding. And in 2020, I created a company called the Coding Nurse LLC, where I help nurses and other healthcare professionals transition into the world of HIM.
Cool, cool. So, good morning. The one thing I did find something I wanted to that came into my inbox. Um, for those of you, and this is something for those of you that not only are in the coding profession and in the coding field and learning all things medical coding, but this is a good nugget and gem for you educators out there. So on March the 8th and 9th, so next week, the wait, every time you pick up that mug, I get excited. Are you drinking tea too? I love it. I love it. I done converted a tea drinker. Hold up. What is the world coming to? Okay, anyway. The on March 8th and 9th, the ICD-10 Coordination and Maintenance Committee is having their meeting. It's a 2-day event. Um, it's virtual, it's free and open to the public. If you don't know, the ICD-10 Coordination and Maintenance Committee is the pretty much made up of the cooperating parties of ICD-10. So CMS will be there, um, the CDC will be there, and the National Center for Health Statistics, or NCHS, folks will be there. And if you get an opportunity, you'll be there as well. And so this whole committee is responsible for approving the coding changes. They develop all the errata, they do the addendas, and any other modifications to the ICD-10 code set. And that's both the diagnoses as well as the PCS code set. So this meeting gives you uh, uh, kind of the preview of what's to come and what's going to be looked at. I think because I think they've already did the one for April. So we have some new codes that are dropping in April, and I believe they've already had that meeting. I think they had it in September, if I'm not mistaken. Um, if I believe. I'll double check that. But so I think this is the information for what potentially could be happening for our October release, but it could be for April. So let me double check that. But anyway, they'll be providing information on both the diagnosis codes and changes to possible potential changes to guidelines, etc., as well as procedures. So if you are interested, feel free to go to the CMS website. Um, you can go to cms.gov/medicare/ICD-10/ICD-10 coordination and maintenance committee. And then there's a link for the committee meetings, and you can click on that. And then it gives you all of the meeting information. And so if you have, and since it's virtual, you can pop in or pop out as you need. But, and the event is you have to register through I think it is through Eventbrite. But they provide you with all the information. So even if you can't stay for the whole day or you miss something, you'll have the full agenda, you'll have the slides. And what's great for educators, particularly well, both for diagnoses as well as, and I'm looking out the window and I should be looking at y'all. I'm sorry. but it's a beautiful Saturday morning. I want to be out in the streets walking. But okay. But one thing that's good for the education community is that you get to hear from those who are looking to either add the code, modify the code, change the code, or providing the actual procedure. So they walk you through step by step what this procedure looks like. So this gives you information on how to teach and train your students on what these procedures look like. And so it just is it's value added. It's great information. So I put you up on a little game. If you're an educator, this is how you get that firsthand information. So just wanted to share that nugget with you today. Mr. Jesse, I don't know if you had any comments on that. I'll mute myself. Oh, I'm sorry. That is a lot of slashes. My bad. Just go. The DW put in a comment That's a lot of slashes. Just go to if you go out to CMS and go to ICD 10, and then you look on the left hand side and you see all the information that they have there, and just scroll down to the bottom and you'll see ICD 10 coordination and maintenance committee meeting. My bad, that is a lot of slashes. Or if you still can't find it, feel free to shoot me a message or put in the comments, I need the information, or and we'll connect and I'll get that information to you. Okay, Mr. Jesse, did you have any comments? Let me mute myself. Okay, this is gonna be a task with this back and forth mute. So if I fail to mute, no, I'll know that I failed to mute because then you'll be choppy. But go ahead.
I hadn't heard that, but that's very interesting information, because very rarely do you have an opportunity to hear people who actually perform a procedure advocate for a code. And you're right, that would be a great learning opportunity, because you get to hear about the nuances of the procedure that you really wouldn't hear or have access to otherwise. So that's pretty interesting.
Yeah, they've been doing this for years, but most of the time, the committee meetings, they're open to everybody. They hadn't been virtual. They've only been virtual for the last, well, I guess during the pandemic. Um, and it so you would have to go through, because they're in DC, and you would have to go, in a federal building, you had to go through the whole screening, and there was a whole process, but they were open to a lot of folks. And so a lot of those um probably resources that you use, you educator, not necessarily you personally, Mr. Jesse, but you use, they're sitting at the meeting. I recognize plenty of names, like, oh, and they're asking the questions and they're doing all the things. Well, now is an opportunity for you to be involved and to hear the information. And I think they're when you register, you can register in a listen only mode where you hear the information, or you can register to ask questions, and be a participant that way. And you can also submit questions beforehand. So if there's something that you're thinking about and you want to, there's an opportunity for you to, hey, I had a question on XYZ. You can submit your questions that way too. So I think it's great. But this meeting has been happening for decades. But it was one of those, as you like to call, gatekeeper situations that folks just didn't know about. But yeah, when you get the information, and actually I use it, I will refer back to, because they keep, so even if you don't get to go to the live session, you can always, I think they keep the meeting minute information or the slideshows or what have you, um on the CMS website, so you can dig back. And so, like, the new changes and things that are happening, that had just happened for 2022, if you have some questions about, well, what were the thought process behind this, you can use that as a reference and go back and do some research to find out, well, what were they thinking related to that. Oftentimes, um, the CPT changes manual gives some updates and information, but this just gives a little more detail because, again, you're hearing it from the horse's mouth. Okay. Hey, Molly. Hey, Miss LPN. If you do you have any questions, or did you have any comments you want to weigh in on that? Feel free. Just let me know. Start talking and I hear you choppy and I know to mute myself. Okay. Well, Mr. Jesse, how was your week? How were things going? I keep you on the prayer list.
Well, I have updates
Uh-oh. Okay.
and updates. So first, I have a little. I'll start with a funny story, because I told you, that my manager had been talking about hiring another CDI person. So she has been sharing, resumes, and like I told you, like, only one person from the first batch she sent me had risk adjustment experience, because for this position, you really, really do have to know risk adjustment. And there are going to be very, very few people who are already in CDI who know risk adjustment. So I have been trying to tell her that they need to change the requirements, because their requirements according to the ad is you have to be a nurse, You have to have 6 years experience in HCC, and you have to have either a CDIP or a CCDS or a CDEO. So I told us the person doesn't need to be a nurse, and they don't need to be certified in, um, in clinical documentation. That can come later. You need somebody who is strong in HCCs because that's really all I do all day.
Okay.
You have to know the coding guidelines for HCC inside and out. So anyway, she sends me this resume, and this woman was, I mean, on in terms of inpatient, nobody could touch her. I mean, she was master's prepared RN. She has like over 7 years of risk of CDI experience inpatient, and I'm like, but I'm not seeing any risk adjustment. So my manager told me that the recruiter had told her that the lady told him that she has 6 years of risk adjustment HCC experience. So I said, okay. I said, so well, you're going to give her a coding test, right? So she said yes. So they interviewed her yesterday because, of course, that like she asked, she backhanded asked me if I want to be a part of it. But you know how people ask you, do you want to be involved, but they really don't want you to be. So I was like, I can take a hint. It doesn't matter to me because I have other aspirations other than to sit up here and interview some people. So anyway, the woman did not complete the test. And when they asked her about her risk adjustment experience, she says she may have told the recruiter that she had 6 years experience in HCC coding, but it was a mistake. How do you act?
Wait, I can't stay muted. Wait a minute. Wait a minute. A whole mistake. 6 years, a whole mistake. Wow. Bless our whole entire heart. Oh
The
my
bottom
God.
line is
Go ahead. I'm sorry.
the bottom line is she got caught because like that test just sealed the deal. Like she had no idea what those questions were asking. So, I mean, I'm like, but we know that people tend to embellish, and you want to be optimistic. You want to think that, all right, if push comes to shove, I can pull it out. I got some skills. I could do it. But she got backed into a corner. She had to fess up. But the thing is, what got me was I may have told him that I had 6 years experience, but it was a mistake. No, you lied, ma'am.
You walking through the door line. Wait a minute. Oh my God, I can't breathe. Bless her whole heart. Bless her whole I may have told you something heart.
So then I want to tell you, so because everybody loves data.
Mhm.
So my manager, we talk maybe Thursday. So on Thursday, she tells me that they got some data on um, the work that I've been doing. So this system that they were using, this third party system, was recommending potential diagnoses to the providers before I started.
Mhm.
So now when I go through, but they were basing their their diagnoses to the provider strictly based off of claims data, like no medical record to substantiate it.
Mhm.
So when I go through and I recommend a potential, I have meat. I have you know facts. I can point to
Mhm.
this particular point, this either in the assessment, in the plan, somewhere in the note where I can identify that this condition was addressed. So she showed me the spreadsheet, and the provider acceptance rate of my potential diagnoses is 96%,
Okay.
whereas the um the accepted rate for the system generated potential diagnoses is like 30%.
Wow. Wow. Mm-mm-mm. Wow. That's huge. And again, your value added. They don't recognize the gem they got. They Sir, ma'am. So, I mean, I'm still curious about this woman that or person that said that they may have told them that they had 6 years of um HCC coding experience. So, was there a flush of the face? Was there a profuse sweat? I mean, what? Wow. How did that end? Were you in on the meeting, or were you actually in the interview with them? And how did that end? I'm curious about that because that is tickling me.
I don't know how it ended. I was not involved in it.
Okay.
This is what my manager told me, and this was we didn't even talk. This was through like Microsoft Teams messages. I'm like, but I mean, I chuckled when she said that she may have told him, but it was a mistake. I'm like, wow, wow. But when I tell you, like, I knew that this woman knew nothing about HCC because her entire resume, everything was all about MSDRG, severity of illness, and risk of mortality. We know that that's inpatient
All day.
DRG all day long.
All day.
I get it. There was nothing about HCC, nothing, no risk adjustment, because they don't do that in inpatient. So there's no in the world you would have known that. And those and how you and the test questions that they ask you, like you really have to know risk adjustment. It's the same test all of us took. So I would have loved to have been there to see, because she didn't even attempt the test. I'm like, first of all, and I'm like, who does this? Because first of all, what happened to the days where you had to take a test? Once you pass the test, then you got an interview. How do you even get a chance to interview without even taking a test now? What did that? Where did
Because
you
of
do
the
that?
shortage and the need. But so were they gonna not have her take the test at all?
No, I guess since she confessed, it wasn't any need. But it seems to me that I think she had to take the test, but since she didn't take the test, that was kind of like that, along with her confession was like it just wasn't a good fit. But I don't even know how you even got to an interview without taking a test. But I get it. Like you said, it's the shortage because every place I've ever applied to, you take the test and pass, and if you pass it, then you get an interview.
Right, that test is part of that whole screening process. So, you're not wasting folks' time and not wasting the person that's looking for the job's time and not wasting the person who is trying to hire for the job's time. So that's interesting. Okay, why do I have Usher's confession? All I hear is "Doo, doo, 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 doo," it just in my back. It just to let you know. So if you see me chuckling, that's why. I'm silly that way.
When I read that message, I'm telling you, I really started to screenshot it and save it for today because I hollered. I'm like, I'm like, did they have a bright light under? Was she sitting under a bright light and were they leaning over the desk? We want the truth. You can't handle the truth.
Oh my god. That boy. Wow, that's funny. I needed that laugh today. Thank you for that. Thank you for that. You have more updates. What else is going on in your world? And folks on Clubhouse, feel free to come up to the stage, introduce yourself, join in on the conversation. We're actually going to take the majority of the time as Q&A. So if you have questions or things that uh, you're just curious about, feel free, place it in the chat if you're on Facebook and or YouTube, and then you can just come up to the stage if you are on Clubhouse. You got the Mr. Jesse, the coding nurse. You got me, the girl with the pearls. You got our undivided attention. We putting you up on a little game for free today, so get your questions together. Okay, Mr. Jesse, go ahead.
So the last update is, I'm working on my trainer, my CDI trainer program. So I want to be. I worked on because you have to do a demo.
Mhm.
So I was trying to. I spent a couple of days trying to figure out the topic, but the first topic I wanted to do, I had to change it because I'm like, I need an updated PCS book, and I'm like, I'm not buying to see a new book and wait for it to come just for this. So I had to pivot. So I did. So I came up with another pitch, another angle. So I put it together yesterday. So it's really almost. I just have to add like maybe 2 more slides, and it's done. I'll be ready to submit it um Sunday night, so they'll have it on Monday. So hopefully I'll find out by Wednesday if I'm approved. I want to finish the course probably today or sometime tomorrow, then take the test tomorrow night, then submit the demo.
Yay.
So I'm excited.
Okay, I'm excited for you too. And I'm thinking, because before we would have some regular cadence with our emails, and I'm like, they must be killing him at work. I forgot about the training, so I'm sure that's taking up a lot of your time. Plus, I need to be writing this 15-page paper. I don't know why I'm playing, but yeah, I'm sure that's taking up a lot of your time as well. That's what's up. I'm excited. Good for you. Good for you. Hi, Molly. I see you came up to the stage. Welcome. Good morning. Good morning.
Good morning. I'm sorry, I was in the middle of washing dishes. Good morning. How are you guys doing this morning?
We are well. We are well. No
I'm
worries.
just I'm just soaking in all the information, just listening.
Well, thanks for coming up. And if you, like I said, if you have any questions, feel free to holler.
Thank you.
Clarice, I also wanted to know, had you heard that there's an article, I'm going to send it to you. A pharmacist has made a request that gabapentin be changed to a Schedule 4 narcotic, and they are considering it. That's It's going to work through the chain, and gabapentin has been problematic for a while now. So
So tell the folks what gabapentin is. Who
okay.
may not know?
Gaba, oh, gabapentin is a medication that is used a lot in neurological pain. And a lot of people who have neurological pain is chronic pain. So you take it for a long time. And you can develop a dependency on gabapentin. And in some foreign countries, it is actually, they have stopped, not stopped selling it, but they have reduced the access because people inject it and people snort it. So it has really become a problem. And in the United States, it is used a lot in compounding, and a lot of basically false claims and a lot of like compounding claims against pharmacists. Gabapentin is usually the drug that is at fault in the compounding scheme. Like they might not have as much of it as they say they do, so they like siphoning some off. So it's gabapentin has been problematic for a while, but it does help people. So I think it's a good possibility they really might become a Schedule 4 narcotic. That way, it is regulated federally, and it is a lot tighter control over the distribution.
Yeah, that's gonna be real interesting, especially by it being a long term um chronic pain med. Ooh, that's gonna be opioid part two. Here we come. Here we come. That's gonna be real interesting. Wow, wow. I'm glad somebody, recognized that the need for that. And probably because, they folks can come after the not only can they come after the prescriber, but they can come after the dispenser, i.e., the pharmacist. And so, I'm glad that they are rallying around each other and advocating for themselves to say, wait, time out. We agree, we believe that, and let's be proactive versus reactive around this drug. So that's what's up. That's what's up.
New Jersey, years ago, when this was in the 90s, years ago when they started, when the people really started to abuse drugs, New Jersey kind of cut, especially psych drugs like the pain medicine and all that, like Ativan, Xanax, all of that. New Jersey came out. This was like maybe '97. They, the state issued prescription pads
Mhm.
that were numbered
Mhm.
for the pharmacy. It was I had never even that was the first place I ever worked that did that, and they were numbered so they could keep track of how many prescriptions this doctor wrote for this type of drug.
Mhm.
And they cracked down hard on those offenders. And if the people who were used to going and getting all kind of prescriptions and willy-nilly, like they were going through it because the doctors couldn't dispense like that anymore because they were being heavily monitored. I mean, we had to actually, because I worked at an outpatient psych clinic, we had to the state sent the prescription pads for the psychiatrist to the facility. We had to distribute it to them. They had to sign for it, like for a certain number amount, and each one of was numbered individually. I'm like, wow, they are not playing, but that's what you have to do.
You do, and that that puts a lot of regulation with folks stealing pads. So this group of pads with this number from here to here, that's gone, and you can report. And so if folks see that, then they know, okay, and they can easily alert the authorities, and folks can be arrested and so on and so forth. So yeah, that's actually a good idea. I think that there are other providers that actually use those number pads now. Hmm. I think I've seen some numbered pads. So yeah, that's a great way to monitor and regulate those prescriptions that are being written, particularly for that. I mean, I remember I had a provider that long story short, he was on 100% Medicare review. He was a pain medicine specialist, and his review wasn't necessarily related to his prescriptions of pain meds. His review was related to the frequency in which he was seeing the patients. So, and not only the frequency, but the level of service that he was billing for at these every 2.5, 3 week visits. So he was, and the documentation didn't necessarily support the level fours that he was billing on every person at every visit at every time. And so we tried to have a conversation with him, like, sir, they warned you, and they did. They warned him several times, sir. Are you sure that this patient who you just saw 2.5 weeks ago and said there were no changes and that there were no problems warrant this level of service? And he kept on and he kept on. And finally, it was like, you know what? We're gonna squash this. We're doing 100% review. And lo and behold, a lot of his stuff got down coded. So as a result of those down codes, he went into a whole frenzy. And then of course he wanted to listen to complaints, and he wanted to have some conversations to help me, talk to me. What am I doing? I was like, sir, you need to understand that. And to his credit, he was really concerned about being sued. He was concerned about malpractice. He was like, as a provider, I don't feel that I'm doing the right thing, but by not seeing them. And we were just, nobody was telling you can see whoever you want to, however many times you want to. But when you bill it, and you bill it to a federal payer, it has to be medically necessary. And so your documentation has to support the medically necessary reason why you're seeing this patient at this time, at this level. And if you can't do that, we got to, Houston, there's a problem. They're going to down code you or deny every single time. And, once we understood his why, which was he was afraid, that if I didn't see him as often as I did and didn't, touch base with them, that they could potentially sue me. And, it was all in the time when the opioid crisis and everybody was coming down on payment pain management providers and so on and so forth. And so he was nervous. And it was like, dude, just take a couple deep breaths, calm down, just make sure that you are documenting the patient as they present on that day. Don't give me from what you know or what has happened or whatever. And like he was doing a whole full exam. Sir, is it necessary to do a whole full exam that you just saw from a patient 2 weeks ago? No. No. So, and they're not even coming in with stuff. It was amazing. It was amazing. I see you talking. Go ahead.
Clarice, I have a provider. I mean, he don't get me wrong, he's good with his patients, loves his patients. That's all fine and dandy. But he emailed me and was like, yeah, I was just trying to run my own report, and I noticed that the code that I'm billing for, the insurance only didn't pay that much. And I asked him, I said, well, what was the insurance? He's like, well, Medicaid. And I explained to him, I said, Medicaid has a set fee schedule. Just because you're billing out um, a $200 visit doesn't mean you're going to get $200, back, because like I said, Medicaid has a set fee schedule. You're lucky to get 3/4 of that back. I said, if you was to do a surgery and it costs $10,000, you'd be lucky if Medicaid even paid like maybe five or four, $3,000. And I just thought it was funny because he expected a full reimbursement back. So yeah.
Bless his whole heart. Bless his whole heart.
You know that is a very good point, Molly, and I would love to know why. And this could possibly be another educational opportunity. I really do believe that medical schools should incorporate some kind of um, revenue cycle training to their to future physicians, because because what you because I just think about nursing. I mean, nursing teaches you no regard for healthcare, no regard for somebody's insurance. It doesn't even come up. You don't even think about what somebody has in terms of insurance coverage. Whatever they need, you provide it. And I'm sure that's how doctors are trained, but that's not the reality that they'll have to that they're going to walk into when they finish. And they're totally just like they're like deer in the headlights. They just don't get it.
I think once upon a time, and it was few and far in between. But some medical schools did have. I can speak for the University of Cincinnati from way back in the day when I worked there because we had a little course for our residents. But I think there was but it was a very high level. Wasn't anything detailed. But we provided that to the residents as part of when part of their residency. And I think now, and let me just go back, because most of the people were actually going into private practice, and so they were developing and getting the information to run their own practice. Well, now they're employed by facilities, and so I don't know if they think it's important enough to have that information because, oh, I don't have to deal with it, somebody else is dealing with it. So I'm like you. I think you still need to know. At the end of the day, you provider are responsible. You are certifying that the information on that claim is correct. To the best of your knowledge, you are certifying that you got the documentation to support it. You are certifying all of those things in order to receive that payment. And when things are not uh, checked off based on your certification, that's when you run into problems. That's when the audit people come. That's when the money comes back. That's when you have to have the paybacks and or denials. So
Right.
again, I think it's important that they have that knowledge regardless, but I think it's not pushed as much as it used to be because again, these providers are, and let me just speak for the states because these providers are actually being employed. I'm learning so much about healthcare in other countries. It's ridiculous. It's amazing to me what is actually happening. Oh, I do have a story, but go ahead.
No, that's it. I just, there needs to be far more education given to providers because it's a huge burden put on them. I wouldn't want to be a provider.
Yeah, they have to know. They have to know. Okay, so this week we were learning about Asia and the Asian countries and what's happening over there. And sir, let me just tell you, in the Philippines and in India, well, first of all the majority of the physicians that are trained in India, guess where they go? Guess where they come to work? Guess where they come to get further training and specification um, on their craft? They come here to the US. Yes, sir. Yes, sir. They come here. Now, some of them have the option to stay, and most of them do, but they're creating but India has said, well, wait a minute. And India is actually going to be the place where all the doctors, because they have a whole big surplus. They're training. They have like 200 and something medical schools over there. They cranking doctors out. But the thing is, they were trying to figure out a way to retain their doctors and keep, it's called brain drain, and so to keep them from going to other countries. It's called medical tourism, and we've already heard it, because especially in our community, where folks are going over to Brazil to have these cosmetic surgeries. So Brazil is the cosmetic surgery capital of the world. Well, we we were introduced to facilities in the Philippines and in India that look like full scale resorts. So you can go to the website, put in your diagnosis, answer a few questions, get information on a provider. You get a list of providers, you'll get their whole history. So where they've trained, and all of them have trained at multiple places, but all of them mostly have trained somewhere in the US. So you got the US Western medicine kind of whatever that gives folks comfort. Um, they'll set you up. Now you have to pay for your own transportation, of course, to get there. But then the schedule comes up. You can select when you're ready to go. If you got your plane ticket and you're ready to go, you can select, you know what, I'll be there in 2 days. I want to have my surgery done in 2 days. They have hotel accommodations available for you, for your family. So if you're bringing your family, because you can make it a trip, if you will, a vacation, if you will, while you're in the hospital. The lobby in and of itself looked like, I'll say, the Aria in Las Vegas. It was beautiful, and I was like, this does not look like a hospital at all. I mean, you talking about the little gift little gift center on the side? No, they have a full scale like mall over there, with all kinds of stuff in that hospital. The other thing is, and we're fighting here in the US about pricing transparency, because but the government is cracking down on that. They about to find the hell out of these facilities, and they preparing it if you don't provide that information. But they tell you, boom, it's going to cost you this amount of money to have this service, and what's included in that service, and what's in the room and board, the pre-visit, the post-op visits, and because you can have, depending on what procedure you get, post-op visits. So if you have to come back or whatever, that's all included in your stay. But it's like a tenth of what we pay here in the States for some of the same type of surgeries. And I was like, you have got to be kidding me. And this is a whole thing. So tourism, we think, at least I think, the ocean, the Caribbean, the relaxer. No, these folks over here getting paid left and right, and they still generate the whole tourism. Hey, they still generate the whole tourism piece, because they're not coming alone. They're coming with their family, so they're still spending money into that local economy. I was just like, what is healthcare is just a whole different animal, and we live by what our kind of narrow view of the United States healthcare systems are. It's a whole animal worldwide. But I was like, oh my God, I'll probably put in the description box the link to the hotel, or the hospital/hotel to me, so you can take a look at their website and play around with it. It's amazing. It's amazing.
Well, you know, over a decade, it's been well over a decade ago. 60 Minutes did a special because what were the people who had money in the United States were going to China for organ transplantation. And they actually showed, and I'm like, Lord, you want to talk about like you know, just the luck of the draw. People who were sentenced to death row on in China, if you just happen to match somebody's blood type and they needed an organ, they would kill you. And they would literally have the person in the OR, and they showed it on film. They didn't show the whole thing, but they showed them walking the person, the Chinese person who was on death row, out to the firing squad. They they killed it. They shot the man in the head, harvested his organs right there, and took it to be transplanted into the person who was already in the OR open waiting for it.
Oh my God.
This was well over a decade ago. It was
No,
on
no, no,
60
no, no.
Minutes.
There was something recently. I mean, cut you off. There was something recently about somebody that was laying in a bed. I don't know where it was. So I ain't gonna put any country on blast. But they were laying in the bed, and they were recently they survived. They were recently released, but they have photos of them. I mean, they just done took every little drop of everything from this person. I mean, they were barely alive, but this was recent. I just saw this. Wow.
It's unreal what's going on out here. It really, really is. I mean, it's scary and it's crazy. Like you would in the 21st century, people are harvesting people's organs. Are you serious?
They watch a lot of TV and a lot of movies. But so to that point, just like you do here in the you shop around, you make sure you validate. You have to do your due diligence. Like if if somebody is saying, you have the information, price transparency on what is included and what's the cost, and then somebody is coming to you like, oh, I can get you in for $50. Really? So where you going? Don't play those games. But you know how we like the bargain. We like the hookup. We'll be the ones on the table getting cut up.
But you know, well,
Uh-oh. We done
Yeah,
lost.
just like that one celebrity, Hazel, she went to Turkey to get a mommy makeover. And she had a lot of complications, and the people were saying that she's lucky to be alive. But she went there, I guess, because they were sponsoring her surgery. If she mentioned it on her live or something. But you get what you pay for, though. I've never heard of no one going to Turkey though to get plastic surgery. That's just maybe they have crackhead prices. I don't know.
but the same thing this the same thing happened with Usher's mother. Usher's mother went to Brazil to have some procedure, and Usher had to pay a doctor from Los Angeles to fly to Brazil to oversee his mother's care and bring her back. I mean, there have been women, black women, who have gone to the Dominican Republic for BBLs and come back and died. I mean, you have to be. I mean, and it is cheaper. It's way cheaper. Like a lot of people go. I didn't know people went to Turkey for body. I know people go to Turkey to get cosmetic dentistry. I didn't know they did other surgery. But it's just I don't know. Everything is not. You get what you do. Get what you pay for, Molly. That's the moral of the story.
Absolutely, absolutely. Oh Lord, but even still, I mean, even if you're going to that reputable organization, facility, or what have you, it's still cheaper than what you would pay here. So why are you still trying to get a further cut or discount? Really? Come on, y'all. We got to do better.
Exactly. We have LA and Miami. Miami is the capital of plastic surgery. So I don't know. Because I guess because it was free, because they sponsored her. It was free. That's why.
a hit and a half for right there. See, I was about to cuss. That's a hit and a half right there. Like, really? Nah. Like, and yeah, you dangle that free carrot, or you dangle that, and folks will jump right on it. But you got to think about your long term. I mean, this is your life. This is, again, complications. How are you now? You doing the mom bod? So how are you gonna take care of your kids now if you can't even get up out the bed every day? How are you gonna? That's horrible. That's horrible.
She took her baby with her and her husband.
No, I mean, with the complications. Now, how are you living the quality of your life now with those particular complications? And
I know she had to stay over there. I think like maybe a week or two more so she can get her, her follow up. I'm sorry, my phone boarded.
It might be me. Okay.
Okay, is that better?
Yeah. Yeah.
And then you just I think about the show Botched. I mean, because what happens is when you go to some distant land across the water to get work done, you could even get work done here. But if it's not by somebody who's board certified, no other reputable surgeon is going to touch you because they don't want that liability. So you go somewhere, something happens, you come back here, you may have to live with that imperfection, or they'll do something to stabilize you so you won't die. But that's about it. Like I don't like you mentioned earlier, like Clarice, what about the quality of life? Because you're barely hanging on, but your surgery still is not corrected. And it's like, people don't think, like, they're just so blinded by, oh, I can look like I'm 22 again. No. Mm-mm.
I thank God for every age. Every year I get, I thank God for it. So I'm not trying to alter anything. If any alteration happens on me, it's because I physically increased my movement. I physically and intentionally changed my diet. Those would be the types of lifestyle modifications I make. That knife, I, I'm afraid when they tell me I have to have a procedure done. So just to do something, and that's just me. No judgment. No judgment.
And
Some
the
people
Anna
live by that knife.
that the anesthesia too. I had a procedure. It wasn't cosmetic. Done years back, and they put me on anesthesia. And waking up is just, I felt like a different person. It's that anesthesia is no joke.
And I have the one thing that I know about me, because I've had like dental, like they had to remove my molars, and I've had tooth ligation and those types of surgeries. But I know that it takes a long time for me to come out of anesthesia, and I have to tell them that anytime there's a procedure, like, don't be alarmed. I may be here a little longer than what you're used to, because it takes a long time for me to come out of that sleep. which could potentially be scary, because what I may not come out one time. So again, I just have to let them know and be prepared for that. Wow. Okay. Cool.
When it comes to medical tourism, I mean, and I understand, because a lot of these countries, they're poor, and that's the instant way to increase a whole lot, because just think of all the people that those hotels / hospitals employ. I mean, they employ a lot of people. I mean, from people picking them up at the airport, people servicing them, bringing them food, taking them, just the staff. It employs a lot of people, and you understand it, but it's just a shame.
It's a whole the and again, these are not uh any of the discounted places. This is a whole for real 5-star establishment. And these providers are your top notch folks are traveling all over the world to see them and to get on their schedule and to be treated by them. And they are, so the thing that makes them even more enticing and makes people really want to go to them is because they specialize. So versus you have a cardiologist here who can particularly specialize in one area, but they may do multiple procedures around that specialization. These doctors are hired to do that one procedure. And so they do it well. And so they've done it multiple times. And so they know, what to anticipate. They can tell the patients up front, I've had this many people who've had this procedure. These are my success rates and so on and so forth. And so people are like, oh, if this is what you do day in and day out, I know you're the expert in this. You are the person that I want to have this surgery or want to provide this surgery for me. And so that is another thing that kind of gives them a kind of a leg up versus, well, yeah, my success rate may not be 100%, or, this is my first one, or I've only done a couple of these, because you don't see that caliber of patient. So it's real interesting. And like you said, I mean, they have translators to speak in most all of the providers, though, at this particular hospital. It's called I'm about to butcher it, Bun Regard, I think, or Bun Regard. Bun Run Grad is the name of the facility. All of the providers speak English. So, but there are other people that don't speak English, and so they have translators. Like, even on the website, they give you the dollar amount in their currency, but then there's a click of a button, you can find out how much it is in US dollars or whatever your currency is for your country. Because not only are folks from the US coming there, and there's I think I saw a YouTube video on the facility where they interview folks from the US, Germany, Canada, and other countries, having their facilities, and asking the question, why did you choose this facility, so on and so forth. So I was just like floored, like, we over here clamoring on these nickels and dimes, and these folks over here killing the game in all kinds of ways. But then think about the claims people, because they do take insurance. While they tell you what the money is, that was the other thing. They take United Healthcare. I want to say it's another one that I saw that is a regular. I know United Healthcare, Choice Care, I think, but United Healthcare was one of the top because my professor is actually from. She mentioned the country, and I'm going to butcher it, and I don't remember, but she's from another country, and they take her insurance that she has here in the States. She was like, she's never gone over to have a procedure, but she knows people who have. And so she was given their experiences as well. So it's real out here in these streets. Go ahead. I'm sorry.
So how in the world does that work that you have American insurance accepted in another country?
Because they have international arms of those insurance brands. And so just like, and the biggest thing about these facilities is they're Joint Commission accredited. And so Joint Commission has an international arm. So it's a JCI, Joint Commission International. So it's a whole game. We don't even know half of the game that's happening around the world. So
right.
Y'all complaining and crying, some of y'all, about, jobs and stuff, look over the pond. There may be opportunities for you over the pond.
But this just seems to me to be, it's a trickle down, because truth be told, the powers that be, the people who have had money, have been doing this for years. Case in point, we have heard for years and years and years how these Saudi Arabian princes and these billionaires in China, because first of all, in most countries, if you're over a certain number of weeks gestation, you can't come into the country because they don't want to give you a child citizenship. But these people are allowed to come into it. They can either go to the UK, they pick the United States, or they pick Canada, and they go and pay to. They'll pay for a whole wing of a birthing suite and have their wives deliver children, so their children can have dual citizenship, and they pay for it, and it's okay. So now that what we're talking about is just that kind of thing, but trickle down to the upper middle class, as opposed to it strictly being something for the upper class to do.
Amazing. Amazing. So again, we can't just we got to think global in these streets, in these healthcare business streets. We got to think global. Just like opportunities exist for folks coming in, opportunities exist for those of us looking outward. So we just have to figure out and find out what those are and tap into those. Yep. Amazing. Something to think about, huh?
Absolutely. I mean, I wouldn't mind, working internationally for about a year or so.
I don't know how convince my husband, but we'll get on the. I'll be like, come on, let's look at this. Right. So again, I mean, you have the business of healthcare, which we are all in. Um, there are opportunities there. I'm sure that's how your AAPCs, your AHIMAs, the international. Somebody saw that there was a need over there. Somebody saw, oh, okay, we could provide this level of service. We could provide this training. We could show you how we do what we do, so you can do it for your country. I'm like, come on, y'all. So,
But you raised a very
my bad. Go ahead.
good point, Clarice. I really do believe that more international opportunities are going to open up in HIM. I really, really do. I just think that you'll have people just have to be willing to try it. And I mean, I worked for the government internationally for like a year and a half, and I actually enjoyed it. So you have to be open, and I mean, basically, all you need to live anywhere is a job and somewhere to sleep. So
Right. And if you got good internet, you're good to go. You can be anywhere. And even still keep in touch with your family and friends, and it's like you ain't missed a beat. Ooh, wow. Yeah, something to think about. Something to think about as we move through. We can't be uh stuck in one particular place or another. Opportunities exist, and we just have to think about it. My motto: don't wish for it, work for it. Go on out there and get it. Go get it. Cool. All right. So we are at the top of the hour. I don't know, Mr. Jesse, did you have any closing thoughts? I see Miss Terry in the clubhouse. Welcome, Miss Terry. Did you want to come up to um the stage? Let me invite you to speak if you want to come up to the stage. Say hi or weigh in on the conversation. But we are getting to the closing thoughts. So, Mr. Jesse, I'll give it to you.
as always, these rooms are so insightful. I mean, we have discovered all kind of international opportunities for employment. Um, it's just it's amazing. So that's why I look forward to every Saturday, because you never know what you're going to learn, and we try to share and put people on as much game as possible, because it is so much opportunity out there, and when somebody closes a door, there's a window open somewhere for you to get in. So I once again, I'm just so happy to be here. I'm just so glad that Clarice has created this space, and I enjoy it, and I hope everybody who is listening got something out of it.
Yes, yes. Thank you, sir. It's fun. It's I love our Saturday interactions. I look forward. I'll be waiting, like, okay, where you at? Where you at? Where you at? I'll see you in other rooms. I'll be like, okay, I know you coming over here. I know you coming over here. So I get excited. And then trying to hold on to whatever it is I want to say, because I have other videos, and I'll be like, no, I'm gonna say that for Saturday. I won't make a video out of that. I'll save it for Saturday. So I have to, go through it and determine and decide, because I feel like, if you take the time, you make the time to stick with us and either listen in on Clubhouse or view us on Facebook and or YouTube, then I want to make sure it's worth your time and valuable for you. So I appreciate you. I appreciate you. So again, thank you so much for joining us this Saturday morning and getting some of the tea. I believe the tea was spilled. Was it spilled? Was it spilled?
Absolutely.
We had some international tea. See, y'all gonna make me go find some international teas to be drinking so I can get myself prepared and ready. So
I went
again,
some Earl Grey.
oh yes, I love Earl. I like that bergamot. I love. Whoops, I love that bergamot. So yeah, I like that. That's good. That's good. Okay, so um if this information was valuable for you, help us spread the word and spread the information and spread the tea by liking the video. That gives us engagement. That shows the algorithm folks of the world that people are paying attention to what we're providing. Share the video. Let somebody know, hey, you know what, have you heard about XYZ? Be the thought person in your group and share that information so you all can have a further conversation, and then you all can come back and we can chat about it as well. And then subscribe to the channel so that you know and are notified, and don't forget to hit the bell so you're notified when we come on live, which is generally on Saturday mornings at 9 a.m. For those of you in Clubhouse, and I think everybody on Clubhouse that's still with us, you already know this, but don't forget to hit the greenhouse to join in our fun club. And of course, you'll be notified when we're coming in on Clubhouse. So again, this has been a great session today. I am excited. I think, hey, Tasha, I was wondering if you were out there. Welcome. How are you? I was wondering, I've been looking through the comments. I was looking for you. So I'm glad you were able to join us today. She's always doing multiple things, but she loves to hear the tea that we spill. And so she'll have us going on in the background. And I appreciate that. Thank you. So again, this has been a great session today. Thank you all for joining. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, and thanks so much for watching.